Jessica Kuji had composites placed over her existing teeth to conceal embarrassing stains. In just 1 year, her composites had become chipped and the discoloration returned. A friend of Jessica's had received Lumineers and recommended them to solve her problem. At 27 years old, Jessica knew that Lumineers were her perfect answer. Upon completing Jessica's smile evaluation, observations included old composites that were stained and chipped, a small left lateral, and an overall lack in uniformity. Her intraoral evaluation concluded adequate candidacy for the procedure with normal temporomandibular condition, no traumatic incisal relationships, and a good standing of periodontal health. Determined by the width of her smile, Jessica's treatment plan included the placement of 8 Lumineers on teeth numbers 5 through 12. Jessica chose the shade B1 for uniform whitening, and cosmetic contouring was limited to teeth numbers 7 through 9.
Okay, let's just before we put on the paint on dental dam, take a close-up of Jessica's teeth. And we're going to apply paint on dental dam. So I just put this all around the lingual, gingival embrasures. Now close your eyes. So that's our first step. To solidify but not make it rock hard, the paint on dental dam. Wherever the blue is, that prevents the Ultrabond from getting in that embrasure and getting rock hard solidified, so it greatly simplifies the finishing process. Jessica has applied 2 solutions to the etched surface of the porcelain veneer, the Lumineer. And I'm going to apply 2 solutions to the tooth. Etch and seal, which is phosphoric acid, with aluminum oxalate. Now the reason I like aluminum oxalate is because it seals the dental tubules. And I like to use etch and seal because it's a medium viscosity, and then I just push a little dab around and I don't have it run all over the mouth. And then we'll leave it for about 20 or 30 seconds, which we did. And then we'll start washing it off. Now we apply Tenure AB. And Tenure AB, in my opinion, is the bonding system of choice. It doesn't need a light to cure it. It's a single, simple application. You have 2 bottles that you just put drops in there. Now, you're probably wondering what I'm putting on the tooth right now, and this is Tenure S. Tenure S will polymerize any of the unpolymerized resin. It'll put a layer of resin on the surface to prevent contamination. So now we're just gently placing these. And this is a critical time, because this is when everything is supposed to fit, everything is supposed to be just right. And you want to make sure you get these seated gently. That's it. And we'll do the bicuspid. Left first bicuspid, okay. Now we'll take the brush and remove most of the excess. Is there Tenure S on this?
Yes.
Okay. And you have to be pretty quick because that Tenure S, you don't want to linger around a long time. And now close your eyes. And I spot cure it in place, always making sure before I turn it on that I see excess oozing out. Now we go to the right side. Take the brush. Close your eyes. Close your eyes. Now close your eyes. And then we'll go on the lingual side and remove the excess there. It doesn't take long to put these on. Close your eyes. Close your eyes. I'm going to take out that paint on dental dam. And I'm using a Sure 349 because it gives me a lot of control. It looks like a scaling instrument, but it's not. Here, well, you can see that coming out there. Take a look at the lingual side now. You'll see those interproximal gingivals. I don't have to clean anything out of there. And the reason I'm using a Sure 349 is you'll never scratch glazed porcelain with it. And the reason I can do this, if you want to think about it, is because I have such great vision. I have supernatural vision. So now I take a 12-fluted burr, and this is the only time I use a burr on the teeth, because I want to remove the resin, the Ultrabond. It won't scratch the porcelain, and it'll enable me to distinguish between porcelain and the Ultrabond. Somebody asked me why I don't do this dry. If you use it dry, you're going to get so much heat on the porcelain, you're going to crack it. And I never use this on the labial surface, I just use this on the interproximal embrasures. See how I'm just following the embrasure with the 12-fluted burr? So now we'll go to the lingual side and see what we have. And I'm just going up the lingual embrasures. Now we're going to take a football-shaped diamond, and this is where we blend the porcelain and the Ultrabond and everything together. It's one solid mass. And I'm looking at any excess I've got in here. Now we'll dry these off, and the next step is to check for occlusion. I can't stress the importance of occlusion. Close. Grind your teeth around, forward, back, sideways, whatever. Now if you take a look in there, we're getting marks on the natural teeth. That's where we want to see it. And if you see any on the porcelain, you want to be sure you give some relief to that, but I don't see any of any consequence on here. So we take the saw, it's called a seri saw. What I do is when it gets difficult, then I rock it. And that's sawing through a little bit more difficult, and then we should start rocking. And then we take the seri sander, and I'll show you this, and I'll just use it on a couple of the teeth. Gets rid of those rough edges. Now what you don't get off today, 3/4 of it will come just when they brush their teeth. Now what we like is a needle nose diamond. And all I'm doing now is taking the needle-shaped diamond, and I'm opening the embrasure, and I'm also removing the shoulder. People say you can't get rid of that shoulder, and the fact of the matter is you can. How's that look to you?
Oh, wow. Oh, they're beautiful.
Aren't they?
Thank you.
Did you imagine they look this nice?
No, they don't look
Yeah.
like my teeth.
I originally went into my dentist with concern about the appearance of my teeth, so he offered to put composite over my teeth to help with the staining and the discoloration. And it worked well for about a year, and when I went back for my cleaning, I noticed that I had a lot of brown spots from normal, everyday staining from eating and drinking. And that's when I heard about Lumineers from a friend of mine, and I was fortunate enough to be able to get them. I feel a lot more confident. I like to smile a lot more. I don't feel like people are staring at my teeth because they look bad. I get a lot of compliments. I would recommend Lumineers to anybody.